Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for intervention testing, piloting, and staging. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Intervention Testing, Piloting, and Staging Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute the rollout of a new program or intervention. It does this by providing step-by-step guidance to conduct usability testing where needed, determine the need for piloting a new program or intervention and guidance to complete it, and finally, guidance on planning for staging and scaling up implementation of the new program or intervention. Intervention testing, piloting, and staging is broken down into 3 parts and 10 essential functions or tasks. And it's important to remember that not all agencies will complete all of the tasks in the brief, depending on their circumstances. And while the steps are presented in a linear way, in practice, often steps will overlap and be revisited as teams test, pilot, and stage. Part 1 is usability testing, and includes creating a usability testing plan and conducting usability testing, analyzing results, and making adjustments. Part 2 is piloting and includes determining the approach and developing a plan, identifying and recruiting sites, conducting the pilot, and assessing results, reviewing progress, and making adjustments. Part 3 is staging and scaling up, including developing and refining plans for staging the intervention and scaling up, identifying sites and sequencing, building capacity and scaling up, and then reviewing progress and benchmarks. In this module, we will focus on the first essential function in the brief, creating a usability testing plan. Let's get started. As a reminder, usability testing allows teams to try out critical intervention components and implementation procedures to see how they work. It may be particularly helpful to test tools, forms, and processes that are being used or adapted for the first time, so they can be refined and finalized as needed. Making a plan for usability testing will help teams set a foundation for learning how the processes or tools will function in the agency context, and to be intentional about the what, who, how, and when of the testing. As an initial test, usability testing provides insights into the user experience with the process or tool. It also helps a team determine whether modifications are needed. This early testing can pave the way for implementation and later evaluation. Teams may want to consider usability testing for intervention core components or activities, for example, assessment practices, implementation activities, particularly new ways of doing things, for example, fidelity assessment tools, implementation supports, for example, new coaching guidelines, and data collection processes, for example, completing data entry forms. To guide usability testing, teams should create plans that describe the testing, including the purpose and goals, so what does the team hope to get out of testing? The focus and scope of the test, what the team is actually testing, for example, one curriculum module, or are there a variety of processes and tools to be tested? The approach, so how the process or tool will be tested. The participants, what groups and how many participants will test the process or tool, or how many cases will be reviewed and how they will be selected. The data and measures to be assessed, including both quantitative data, for example, the counted numbers of parents contacted, and qualitative data, for example, caseworker responses to prepared questions about their experience. The data collection approaches, for example, will the team use focus groups, surveys, or case reviews, or a combination of these? The criteria for revision of the process or activity. So what will help the team decide what to revise and how to revise it? The individuals or groups responsible for testing, reporting results, collecting data, making decisions, and acting on the results. and the timeframes and schedules for the testing period. It helps teams to consider the what, who, how, and when while creating the testing plan. What aspects of the intervention or implementation process will benefit from usability testing? What processes or tools are being introduced for the first time or are being used with new target populations? What is the purpose of the usability test? What is the scope of the usability test? What data will be collected and how? Who? Who will participate in the testing? Who will be responsible for collecting the data? Who is responsible for conducting the test? And who is responsible for acting on the results? How? How will the processes or tools be tested? How will data be collected? Will there be focus groups, surveys, or case reviews? How will revisions be determined? Will there be multiple testing cycles? And when? When will the testing be conducted? What is the schedule for testing, adapting, and retesting if needed? Let's take a look at an example. During the 2012 Permanency Innovations Initiative, the Fostering Readiness and Permanency Project outlined their usability testing plan. The project comprised of 3 unique interventions that were part of the overall project: the 3-5-7 model, family finding, and a child advocate and recruitment expert of care team. Then they developed their plan for usability testing by identifying 5 components that they wanted to test, including the viability of the collaborative care team, assessing the capacity of quality assurance tools to measure fidelity, assessing the viability of the care model with the youth target population, determining the viability of the approach used for clinical supervision for youth advocates, and determining the viability of the process selected for case mining. The usability testing plan included the scope, purpose, and time frame for testing, and who would be participating in the testing. What components were being tested, including the data measurements to collect and review for each component. The method of testing for each component, for example, surveys, focus groups, or other methods. The team's plan for quality assurance crosswalks, and who would be responsible for collecting the data on each component, as well as the criteria that the team determined would help them make decisions about usability or revisions. It sounds like the team has thought out the plan strategically and proactively and are prepared to move forward with testing. Let's take a moment to check in on what you've learned about developing a usability testing plan. Why do teams create a usability testing plan? To set a foundation for learning about how selected processes or tools will work in the agency context and identify critical components for the testing. How do teams create a usability testing plan? By deciding as a team what processes or tools would benefit from testing and outlining the key components of testing for each. What can help teams create a usability testing plan? Thinking through the what, who, how, and when of the processes or tools that need to be tested. Now take this a step further by reviewing the reflection questions for Create a Usability Testing Plan in your Intervention Testing, Piloting, and Staging workbook to connect what you've learned to your own experience. Up next is Conduct Usability Testing, Analyze Results, and Make Adjustments, the 3rd module in this series and the 2nd function in usability testing for change in implementation.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.